Okay, today we're going to open up to chapter 31, which is on periodontitis. Now, you have a few people that's going to be on your team when you're working in a periodontist office. Okay, of course, you have the periodontist, and he pretty much specializes in, treating the disease of the tissue that's around each root of the tooth. Also, there is 3 out of 4 people who will actually experience periodontist disease, in a lifetime. But overall, the periodontist, his objective is his or her, shall I say, his objective is always one, to find the source, two, to figure out what's actually causing the patient to have the disease and how to prevent the patient from continuing to have the same disease. Okay, you are also on the dental team. You're responsible for room preparation. That's pretty much, setting up the room for your patients and disinfecting the room after each patient. You want to be able to seat your patients and dismiss your patients. And most of all, practice chairside assistant, whether that's four-handed dentistry or six-handed dentistry. You will also be responsible for scrubbing instruments, keeping up with patient charts, making sure everything is stocked in the office. Some offices provide you with a hygienist. Your hygienist is strictly there to perform cleanings and examine each patient. And of course, every office has their business staff. That could be the receptionist. The receptionist is pretty much responsible for communicating and scheduling appointments with patients. And they're also responsible for communicating with everyone in the office that works in the back so everybody can understand who's on the schedule for the day. Now, here's a little bit more information on your role as a dental assistant. So, once you become ETA, or once when I say ETA, that's extended duty experience. Of course, you have to have some experience to be certified in ETA. Okay. Once your doctor trains you and you and your doctor receives understanding between each other and builds that trust, your role pretty much is doing everything the doctor would actually do with the patient. For example, okay, you will sometimes be placing periodontal dressing and removing the dressing from the patient's mouth. I did post a video on how to place dressing and how to remove the dressing. You will also be removing sutures, polishing any teeth between patients. We always have to take radiographs. That's your x-rays. That's the only way we can properly diagnose our patients. We will also take impressions on patients. You will also apply fluoride treatment. The impressions we take in the lab, the fluoride treatments we give in the lab, and pretty much help educate your patient. Okay, there's a difference between educating your patient and pretty much trying to diagnose your patient. You only want to educate your patient. Now, let's go ahead and talk about some of the symptoms that you can be looking for when you're with your patient. Now, anytime your patient is experiencing any gum disease, which is, by the way, very uncomfortable and embarrassing for the patient, when you look into your patient's mouth, you want to go ahead and look at if there's any bleeding. On the gums, any inflammation around the gums, any perio pockets, that's interproximal between the teeth, any malocclusions, halitosis, that's, if your patient has a really strong foul breath. You want to check the tissue and the gum line around each tooth. If there's any recession, any abnormal contouring, meaning, if the tissue, has discoloration, if some of it is even missing, and overall, if your patient has any pain or tenderness going on in the mouth. If you have any questions, go ahead and message me on Edmodo. Now, some of the causes of periodontal disease could be various of things. Sometimes your patients will have like a local irritated or bacterial infection from plaque. The minerals may appear yellow or brown deposits that are actually on the teeth. Sometimes the deposit becomes hard, and then that's when it's called, calculus or tartar. Some of your patients just have poor oral hygiene. And when they're not brushing and flossing the way they're supposed to, of course they're going to have buildup. Of course they're going to have tartar. Of course they're going to have plaque that begins to grow on the tooth. And sometimes your patients could be brushing and flossing, doing everything that they're supposed to do, but they have a improper nutrition, meaning that they have a lot of bad eating habits. Sometimes when they have a bad diet, of course that is healthy. And overall, the tissue can, begin to carry disease from all the sugary items that they're eating. Okay. Any malocclusions, that's from improper teeth alignment. They need to get in and see an orthodontist to correct the alignment of the teeth. And when they have bad alignment, with chewing food, drinking drinks, they get stuck in tight little areas where it's hard for us to get in there and clean, and it's hard for them to get in there and clean. So, if you have food just sitting in the teeth or drinks and sugar, you will begin to see caries. And sometimes your patients that are stressed, um, stress can lead to grinding their teeth, and that could be in their sleep, that could be while they're working, they're in school, things to that nature. Now, any systematic factors in periodontitis can be anything from um, a hormonal imbalance. You'll see a lot of periodontal disease in pregnant women. You'll see that in some patients that are taking, strong medication, like your cancer patients and things to that nature. It's out of their control. Now, your classification of periodontal disease could be gingivitis. That's one. Gingivitis is where the gingival tissue become inflamed, and it's also a common amount of, it happens in all ages. It's not just, older people. Now, your classifications, as I was saying before, it can just be caused by poor fitting appliances, build up disease, any drug therapy that your patients could be experiencing. Now, you also have periodontists that, um, you're just a periodontist issue where you're just, losing your bone support, and it's pretty much deteriorating over time. And without that bone, you really cannot, um, keep the remaining teeth in your mouth because they will all become loose and you'll have mobility. And without that bone that each tooth sits in, they have no, they won't be stable. They have no stability without that bone. Now, when we get into your UNG, that occurs most frequently in your young adults, and it's caused from stress, smoking, their diet, poor oral hygiene habits, and you'll see this more commonly in college students. Around the time they have finals. And when we have tests and finals, we are very stressed, and some people are stress eaters. It's different levels to it. Now here you can see in this picture, it shows you a picture of unhealthy tissue, and I'm going to pretty much highlight the unhealthy tissue. Okay, if you look here, the tissue around here is pretty much inflamed. You can see the buildup here. This person, you can see the discoloration of the tissue. It's not like pretty pink red. Um, it's it looks dehydrated. You can see the buildup between the teeth here. And this patient is pretty much not flossing, not brushing. And, from the looks of it, this patient still has a chance to, how could I say? Um, this patient still has a chance where they could save their teeth, with some periodontal cleanings, flossing, and them just keeping up with good at-home habits of cleaning their teeth. Here you can see that this patient has a lot of calculus buildup on the sublingual. And remember, lingual is the surfaces that's located behind the teeth. All your teeth in your mouth has a lingual surface. If you bite your teeth together right now and you take your tongue and pass it on the back of each tooth, this is your sublingual. Here you can see the buildup that's forming behind the patient's teeth, and they could brush all they want at this point. Um, they need to get in and get a good perio cleaning. Okay. Now here is just a dental check. I will be posting this question on Edmodo, so make sure you go ahead and get the information, get the question, and we will talk some more about that. Now, periodontal diagnosis procedures. You know that we have a protocol to follow each time we see patients, and that it's anywhere from how to talk to your patients, how to properly word a question without offending the patient. So let's talk a little bit about some questions you can ask your patients just to build that conversation, that trust with the patient. We know we have to do a medical dental history on our patients when they first come in, and each time they do come in, we have to do a medical history update. I don't care if we seen them yesterday and they came in today, we still have to pretty much update their medical history each time. So questions you can ask your patient: why did you come to this office? what are areas, and if any of the areas are causing you discomfort. You can ask your patient, do you have pain in the ear or the mouth? Do you have any sores or inflamed areas? Are you taking any medication or being treated for any illness? You can also ask the patient, you know, are you allergic to any medication? Are you pregnant at this time? Do you have any disease? Um, you know, Also, you want to be able to provide information about oral history and any habits the patient may have. For example, you can ask your patient, how often do you brush your teeth during the day? Do you brush twice a day? Are you flossing? Um, your patient may have a habit of chewing tobacco, smoking. It could be a drug user. It could be all those different things. And you want to make them understand that some of the bad habits they have could cause, cavities. They could be a drinker. They can smoke. And when you're drinking and smoking, brushing and flossing is very, very important. Each time your patient comes in, we're going to have to do a exam on the skin, lip, the palate, the lip nose, the TMJ. Remember, we had a session with MBC on practicing these different techniques on the patient. And if you want, while you're home, you can go ahead and get, your mom, your dad, your children, get your family involved, and hey, let's check the skin, the lip node, the TMJ, any jaw popping and things of that nature. And you can actually use these pictures to help assist with that. When you get into the oral cavity of your patients, you want to make sure you are looking for any abnormal color on the gums. You want to check out the size, the texture, and make sure that the tissue is a pretty pink color and everything is smooth and clean inside. And then, you're definitely, while you're examining the patient, you want to, evaluate if your patient has good oral hygiene habits, and you want to go ahead and chart all that information down. Remember, charting is very important. You want to make sure that um, when you're in the office and you are examining the patient with the doctor or hygienist, you want to make sure you know how much plaque, what area you've seen the plaque in. When you're going to be probing, I posted a video on what probing is. You want to make sure that you are putting in the correct numbers. Also, anytime you're probing, any pockets, the deposit should be 3 millimeters deep or less. That's good, healthy tissue, okay? Now, when it's deeper than 6, we want to make sure we're definitely recording that, and that's signs that, your patient is suffering from gingivitis, maybe some periodontal, you know, uh, disease going on in there. So um, it even could be some teeth mobility where the teeth is loose. And that's when you're going to use that method of, pushing the tooth back and forth with the instrument to determine how loose the tooth is. And here we talked about periodontal examinations. That's pretty much where you're going to be evaluating your patient. Now, to screen your patients, and when you're screening, now if you're not sure what screening is what we do when we go on our field trips, when we go and do our dental cleanings on the patients. Um, when you're pretty much evaluating the time, you evaluate the patient's teeth, what you've seen inside the mouth. If you didn't see any issues, you always notate. no concerns. Just follow up with your dentist every 6 months, things to that nature. Here is a x-rays, and it pretty much shows you different ways to look at an x-ray and determine if you detect periodontal disease on your patient, if there's any bone loss on the patient. Okay, here let's talk a little bit about this bone loss the patient has. So here is your vertical bone loss. As you can see, um, the bone is here on the max and here on the man. All right. Naturally, you want your patient's bone support to be here. And, this patient bone is starting here. So here, this white grayish area that you see, that's the bone loss. You can even see it here. Here's the bone loss. Well, we would rather our patient's bone support to be here. Here's your horizontal bone loss. Here, we want this patient's bone support to be here. Okay, that's the way you can read your periodontal x-rays, your periapical. Now, the two x-rays that you see on here, this is, of course, bite wings. Now, anytime your patients will come in, we want to be able to treat the patient, and sometimes we have to prescribe that patient some type of agent to maintain the discomfort after we clean the patient's mouth. Sometimes we can treat that with antibiotics or anti-inflammatory pill, and that could be, of course, your antibiotics is going to treat the infection that's in the patient's mouth. And if the patient is in pain and the gums are inflamed, we can definitely give them some type of ibuprofen. So once you get to before you're actually even gonna do any treatment on the patient, we have to come up with a treatment plan. Okay, so at the consultation appointment, you are going to chart all information that you received on the patient. You're going to take x-rays. We are going to take impressions to have a model on that patient's teeth structure. And the patient, and you can actually use that model, and the patient should have a good understanding of what he or she is experiencing in the mouth. So you're going to definitely answer all questions that the patient may have, and you're going to explain the entire plan. We're going to plan out appointments, and we're going to make financial arrangements to make sure that the patient can afford the treatment. Now, some of the instruments you're going to use while, diagnosing your patients. So here's your metal, I'm not going to say metal, but your stainless steel probes right here. Okay. Now, this little raspy piece that you see here, this is what you're going to use to sharpen the points on each probe. Okay. If you have a dull point, you will not be able to probe your patient properly. Now, when you get to probing, I posted a video on exactly what periodontal probing is on your patient, and that's when you are measuring the deposits around the tooth structure, how much bone you have. If it's 3 millimeters or less, your patient is fine. If it's 4 or more, your patient is experiencing some gingivitis disease, possibly bone loss, and so forth. Especially if you're probing and they have bleeding spots, that's signs that they need some periodontal treatment. Here is your explorers and your curettes. Your explorers will come in different shapes. They have the pigtail, they have the hook like we use in the lab, and you have your curettes. Your curettes is, you have universal curettes, and it's pretty much used to remove any calculus buildup that could be on the sublingual surface, or pretty much any of the periodontal pockets if there is any buildup there. When I say periodontal pockets, that's in between the teeth, interproximal. We talked about the scalers. Your scalers, we have our sickle, our chisel, the hoe. We have different types of scalers. Here's your periodontal instrument, and this is where you're using your Cavitron tip. And right here is your Cavitron tip. This is the Cavitron tip. Okay, and this is your ultrasonic unit, and you can control how much water right here. You can control how much pressure you need, and this little throttle right here is what you're going to use, and you're going to control that with your foot. And you can press it soft, you can press it hard, and this is going to control the water and the pressure from coming out the tip of that Cavitron. And this blue cord right here, this is what you're going to use to connect to the water. Of course, after any cleaning, we're going to polish the patient's tooth. And it could be one tooth, it could be all the teeth, it could, we're going to polish the teeth. Also, not only polish, sometimes we are going to place sealants in the patient's tooth, and I posted a video on that with some questions for you to fill out. We're definitely going to have to polish, and when you polish, it's pretty much removing any debris that could be on the patient's teeth. Okay, moving on. If you have any questions, like I said, just message me on Edmodo. Here's some more instruments. I would like you to take some time to go through your chapter and look at the difference between the instruments. I will be posting a quiz on each instrument, so make sure you're following up. Here's some elevators, your periosteel, your rongeurs, different forceps. This is showing you where they're pretty much using the instrument to clean the subgingival. If your patient would have any extra tissue around that gum line, we would definitely have to laser it. Laser it is one of the best techniques of removing tissue, because as the laser is cutting the tissue, it's also sealing the tissue, and it prevents any bleeding. It's just a better healing process for the patient. Here it gives you a list of your different reasons why you would laser. Definitely highlight these notes in your book. Here it's showing you a picture of lasering the teeth, and it's giving you a list of benefits. Exactly what I said. It minimizes discomfort, swelling, a better healing process. It prevents less bleeding. Here's another dental check. I will be posting this question on Edmodo. Some of your non-surgical procedures, of course, that's just adjusting uh, the tooth if it had any high spots, and any scaling and polishing when you're removing plaque from the tooth. That's your non-surgery. And I want you to go through this list so you'll be prepared for your quiz. Also here, it's just showing you examples of how they would actually place the scalers, the probe, where exactly it's going between the tooth and the gums. Once again, here's another list of your non-surgical procedures, root planning, things to that nature. We know we want to always give pre-op instructions to the patient so they understand. One, when they come in, they need to be able to confirm that they understand the procedure, and that's just signing off. Explain the procedure, answer any questions your patient may have, and make sure they confirm and sign off if they're going to be under sedation. Now it's giving you a list of some of your surgical procedures. I definitely want you to highlight these in your book and make sure that you are understanding which is which for the quiz. We talk about these all the time in the class. Um, Here's another one. It's just showing you how they're placing the instruments. This part is also in um, your textbook on chapter on the periodontal chapter, and this is where they're showing you how they're doing a surgery procedure called the flap surgery, where they have to remove some tissue. Let me just show you really quick. So here they're removing this tissue in order for this tooth to come out. So it's not so much just tissue. It could be anywhere from some bone that's being stubborn and not letting that tooth erupt. And you know, sometimes we have to do that. Here is another list of your surgical procedures. Make sure, I want you to go through these procedures, and I want you to not post, but send me a message on, you know, each one. They will be a part of your quiz. I will be posting videos on certain procedures,